Hello, I'm Maria Hall Brown, and this is LA Currents. Well, if you still have any sense of time, you realize that it's been a year since the World Health Organization designated COVID-19 a pandemic. A lot has happened in this last year, but we still have a ways to move forward. Fortunately, we have some great experts to help us along that way, including Joanne O'Brien from LA's Medical Services. So nice to have you here.
Thank you for having me.
So we've spent a lot of time together over the last year, and you were
Yes.
the first person that really kind of gave me some insight into how we can protect ourselves from the virus with hand washing, etc. But even at that moment in time, so little was known. Now, a year later, what do we scientifically know for sure?
This virus is spread through respiratory droplets. We know that for a fact. We know that when we talk, when we sneeze, sing, all of those things, that little droplets come out, and if you happen to be standing next to someone, you can breathe those in through your nose and mouth, therefore become infected. And what the scientists know that those individuals that are singing and coughing and that are infected, the virus has replicated enough, and they have enough of it in their system to spread it. So that's what we know.
So, although things feel better, in particular in this part of the country, and things are opening up and people are getting vaccinated, there are still we need to take precautions, yes?
Absolutely, absolutely. You know, we're sort of at a plateau. We know we still have a lot of cases. It's very exciting. Things are moving from the purple to the red. But everybody needs to take a step back and look at their individual risks. If you get the virus, will you become really seriously ill? Will you spread it to someone in your family who may become seriously ill? Will you be around a lot of people in a closed environment where maybe the ventilation isn't good and people aren't wearing masks? So you need to take all of those things into consideration, and it's very much of a personal choice. The virus is still out there. We know that in the United States today, about 12% of the eligible population has been vaccinated. So we still have a long ways to go. I think we've learned to live with the virus. You know, if you stay away from people. So all of those things still need to be in place, even if you've been vaccinated. You need to wear a mask, wash your hands, stay far away from someone. But the upside, it's very exciting now that if you're with a group that is vaccinated, you know, you can maybe have a dinner with them, and that's exciting. Mm-hmm. You know, for small groups, maybe in your house, in the backyard. You know, you still need to be smart, but we're definitely moving in the right direction, and it feels good.
You know, you mentioned ventilation. Just literally airing out your house, making sure the doors are open and the windows are open. I mean, that was something that seemed, you know, maybe a natural instinct, but now it's being sort of promoted more, because that definitely allows the virus to not necessarily get across the room to you.
Correct, exactly, yes.
All right, so now the eligibility requirements for the vaccine are opening up. You know, it's really just a matter of whether we're going to have, you know, the amount of vaccines necessary. So who can now get a vaccine? Who can now sign up?
Well, I'll see if I can remember, because the list is getting larger.
Yes, it is.
But we start out with healthcare workers and individuals that are living in a nursing home, and the workers in a nursing home, the residents and the workers, to EMS workers. Now we're looking at policemen, people that provide safety, our transportation workers. We also have our agricultural food workers. If you're 65 and older, or if you have a chronic illness or a disability. I believe I hit them all.
I think you did. And
yeah.
Teachers are part of that list, correct?
Correct, yes.
Absolutely.
Educators.
Education.
Yep.
All right. So there should be kind of an awareness of there's a portion of the population that, despite the value of the vaccine, maybe shouldn't get the vaccine. Is there a way to clearly identify whether, as much as you may want one, it may not be a good idea for you health-wise?
Great question. Great question. Right now, what the scientists are saying is the individuals that should not get a vaccine are those individuals that had a very bad reaction to the first one. If you're getting one of the vaccinations that are a two-step vaccination. Other than that, in people that have a immune system that isn't very strong, they didn't really do any scientific studies on those individuals, so they don't really know if your response is going to be good. But they did do some studies on individuals that have stable HIV and cancer, and it proved to be very safe and effective. And what I would say to anyone, if they're concerned, or maybe someone who has a lot of allergies, to talk to your doctor.
Yeah,
You know,
because
ask those questions.
I was
Yeah.
concerned, since this obviously is a boost to the immune system. People who have autoimmune disorders, I was wondering whether, you know, they should check with their doctor first before they schedule a vaccine.
It's always a good idea, you know, because this is so new and there are populations that they haven't studied this on. So I would recommend that.
And I understand that there are studies now, because there is an age limit as to who's, you know, 16 on one vaccine and 18 on another, that they're actually studying whether children are going to be able to get this vaccine
Yeah,
too.
so exciting. That's really, really exciting. That I believe that just started yesterday.
Yeah, exactly.
So we'll sort of wait and see. But that's really, really good news.
All right, so now here in the U.S., we have 3 options. We have Moderna, Pfizer, and now Johnson & Johnson. Does it matter which one, and are there major differences in the vaccines and how they react in your body?
What I would say is, if you have the opportunity to get a vaccine, get it. Doesn't matter which one. At the end of the day, they all help prevent getting the COVID-19 infection. Even if you do get it, you're not going to end up in the hospital. You're not going to become severely ill. So if you have the opportunity to get any vaccine, get it. Moderna and also Pfizer is the mRNA, and that's where they sort of change the DNA of the virus to kind of teach your body to make the antibodies. Doesn't change the DNA or your DNA or anything. It just teaches your body that if you do get exposed to this virus, that your body will know what to do. And sort of the Johnson & Johnson is sort of the old school, sort of where we're used to vaccinations that are a weakened, you know, virus or a weakened bacteria, where it's not going to make you sick, but your body learns to make antibodies. So at the end of the day, they all sort of work the same, where they teach your body to make antibodies so that if you are exposed to it, you won't get severely ill.
Definitely a learning curve. Obviously, as I've said, you know, a million times over, you know, we're learning on a daily basis. Do we have any idea at this point how long the vaccine protects you from the tragic damages of COVID-19, even if you get it?
We don't know exactly how long and the effects of the immune. That's still, it's so new. It's being studied. What I have heard and read is that definitely 100% it'll keep you out of the hospital.
Wow,
And that's huge. That's important.
Because something that
So-
we have to remember is that, you know, everyone has responded differently if they have in fact gotten the virus, and now we have those sad continuous effects. You know, the long haulers, these people that have finding that there are damages to their systems that they are not even aware of yet.
Right, that they're still studying. In fact, there are individuals who didn't get very ill, but then maybe 2 months later, they just have these terrible side effects of being tired, very fatigued, short of breath, all of those things, memory problems. So getting the vaccine prevents all of that from happening.
What things does it not protect you from? I mean, what things should you still, I mean, we talked a little bit about this just a couple minutes ago, about we should still protect ourselves with the masks and the social distancing and everything, but we shouldn't be so full of bravado after we've gotten the vaccine. We should still
No, because if you think about how new, we just learned about this virus a year ago.
Right.
And within that year, we created a vaccine. So we kind of have a lot of science and research at the same time while things are happening. So there's so much to learn. And we also know the vaccines don't protect you 100%. 100%. So you still need to do your part to prevent the spread and not bring it home to your family, take care of the community. So it's like we have all these tools in our toolbox and you need to use them all.
Do we know yet whether you can give someone COVID even if you're vaccinated and you're not feeling the effects of it?
The research sort of is pointing towards no, but that's still not out. There's still no formal response to that.
Okay, lots of headlines, lots of zealous, frightening words, variant. I mean, the West Coast has its own set of variants.
Of course we would. Yeah.
We're innovative.
Yeah.
We have to have that kind of. So these variants, are they making a difference in regards to the efficacy of the vaccine? And should we just be conscientiously aware of them and not terrified by them? Or, since you have inside information, is it of great concern to the medical community?
I think, as I said earlier, we're still researching. Just to sort of back up, viruses mutate. This is what they do. And the more opportunity they have to replicate, to spread, the more opportunity they have to mutate. So that's part of why we want to stop the spread, because if it's out there in the community and just moving from person to person, it's going to change a little bit. And when it changes, and what we know about the variants right now is that it's more easily spread. So, I'm making this up. Say, the first version of this, it would take like three of the little viruses to make you sick, and now it only takes one. And that's not exactly what happens, but you can catch the virus much more easily with the variants. In terms of, do they make you more ill? I don't think we know that yet, but we need to respect that it's changing, and we know that the vaccines do provide some immunity to these. We don't think it's the same type of immunity. You might get sick, but what they're still saying, it's going to keep you out of the hospital. But so that's why it's so important, because this is so exciting. We have a vaccine, and we know all these other things that we've all learned early on. Wear your mask, stay away, wash your hands, and get your vaccine. We'll get a handle on this, and we can all exhale, literally.
And give everybody a big hug.
Yeah.
Your point is valid in regards to this virus. You were truly the first person that said to me that the hand washing is so important, because the virus itself, when it's just not in your system, is fragile, because it has a very not very strong shell. Friction can destroy it. And now I'm learning about all of the treatment, even if you do end up hospitalized. I read about a study. MIT is saying that definitely in the early stages, definitely don't know, whether it could be utilized in terms of treatment, but ultrasound can actually destroy the shell and the spikes of the COVID-19 virus.
Yeah, that's exciting. It is. In terms of the vaccine, we're also learning to treat people and try things like put, when a person's having difficulty breathing, something that was like unheard of, to put them on their stomach.
Right.
We wouldn't have ever thought of that before. Who knew? But it absolutely works. We have antivirals. We have the monoclonal antibodies now, because so many people have had it, and so donate. It's, if you've had that, that helps. It helps. It definitely turns it around.
Okay. Let's go back to vaccines for a moment. There are reactions to vaccines that vary as widely as people's reaction to the virus itself. There is probably a line in which this is just a normal reaction, and this is the one that you need to contact your doctor and find out whether you are having an allergic reaction or whether you should not, you need medical attention. So where's the line between this is just what's happening with people, and this is a big better call somebody?
The most common side effects with the vaccine are a sore arm, and if you've ever received a tetanus vaccination, it's just similar. You go to sleep at night and you're like, ow. You'll feel like somebody punched you in the arm. It's completely normal. Feeling a little tired, a little achy, might have a headache, and might even have a fever. It's very short-lived, 1-2 days, and then you're completely fine. It's your body is responding to the vaccine and is making antibodies. It's doing what it's supposed to do. So in a way, it's kind of a good thing. If you have shortness of breath, can't swallow, that's sort of like a very bad allergic reaction, anaphylactic. If you happen to be at home and that happens, just call 911. After you receive the vaccines at the sites, you should be sitting for 15 minutes. And typically, if you're going to have that bad of an allergic reaction, it would be within that short window. So,
along the lines of, now people are queuing up, to get in the virtual line to get their vaccine, and a lot of these vaccine locations are popping up in a lot of different areas. Is it difficult to find a vaccine right now, or is it easy to get online? I know myturn.gov.
Yes. myturn.gov, first of all, to see if you do
Eligible.
qualify and you're eligible to receive it. And then I would go to, at least with the city, we have corona/virus.la, and there's a tab for vaccines, and you can kind of get in the queue to get like an alert, make an appointment. You know, sign up for everything you can, you know, online to get alerts. Okay, you know, we're opening up a site so you can get in the queue. If you're not politically savvy, if you're not computer savvy, have a friend. You know,
That's what I read. You can help your friend and your neighbor and your relative.
Yeah, yep. You can totally help. In fact, there's groups of people that just sort of help individuals that aren't really computer savvy, don't know how to sign up. You know, there's plenty of help, so reach out for sure. But get in line, be patient. I think as time goes by, more and more vaccinations will be available. I heard they're releasing more and more and more.
Yeah,
So
the supply seems to be
you know, and it was sort of that lag. We knew that would happen. You know, it was sort of, is this working? Is it okay? And then you had to give the manufacturers time to get it out. But I think the distribution is going to be just fine by May. Yeah.
What about testing? You know, for a while, testing was the priority. Make sure you get tested, get tested, get tested. Is testing still as much a priority as it has been, or is it?
It's just as important.
Okay.
It is one of the tools, like the few I talked about earlier. This is absolutely one of the tools, because if you're sick, you need to go get tested, because you might have been around people and they need to know, so you can stop the spread. So it's part of stopping the spread. If you've been exposed, you need to know. And because we all also know that 40% of the people with COVID do not have any symptoms. But if you were around someone that you know tested positive, you need to go get tested. And these numbers also help public health make decisions on when to open. When can you send kids back to school? Where is there a cluster? Because now we have the cavalry. We can go and send vaccines to this neighborhood. If all of a sudden this neighborhood's on fire with cases, we can go and send help. So it's a very important tool.
Now that we know that it's really airborne, one of the first things that we were very concerned about was its longevity on surfaces and the need to disinfect and wipe down surfaces that would be communally touched or even in your own home. Have we learned how long it lives on a surface yet?
You know, the studies show anywhere from 2 hours to like 9 days.
Seriously?
Seriously. So and because the variability is, you know, where is it, you know, what's the weather like there? Is it outside? Is it inside? You know, if you had somebody who's sick and they happen to be sitting and sneezing and they don't have a mask, and then you sit down, theoretically that virus is there. And if you happen to, you know, put your hands on and then it's your eye, you know, hypothetically you could have inoculated yourself. So I would still wipe off surfaces, wash your hands, do all of those things. They're not hard. That's the great part. None of these things are really hard to do.
Because we need to be cautious. Fortunately, we're in a good place in which, you know, we've gone down 42% in terms of people with COVID, and it's definitely moving finally in the right trajectory here in the Southland. But you look at the Midwest and you look at other countries, Poland, India, Brazil. I mean, they've got spike 3 happening now, and it is almost more devastating, just like our second spike, our spike was more devastating than our first encounter.
I think we need to definitely watch what's going on in the world and learn from them. We kind of followed Europe, you know, through this pandemic, and we can see that Italy is in a lockdown right now. But I always sort of step back. If you think about when this first became a pandemic, when we first started learning about it, literally in weeks it went around the world.
Yes.
So, you know, we would be foolish to not look at the rest of the world and learn and just do the things we know that work.
I know, if you just look at the timeline, which we now have this interesting perspective of 1 year, just even when it was first realized to where we are now, it's jaw-dropping how rapid everything happened.
Yes.
And we still have to be careful, because you know, just because it feels better doesn't necessarily mean it's over. A lot of things we also need to be conscientious about. Those of us who are sitting here having these wonderful conversations feel liberated somewhat, and hopeful, but there's been a lot of heartfelt tragedy. People lost loved ones. People are sick and still feeling the ramifications of the virus. How are we going to be on the other side of this when it comes to, you know, the after effects of loss of employment and loss of loved ones and social isolation and everything like that? We need to be aware of those components too.
Right, absolutely. It's just been a worldwide tragedy and suffering, and we shouldn't forget that. It's been a really, really, really hard year for a lot of people. People need to be kind to each other. We need to take care of ourselves, get proper rest, eat the right foods, go outside, reach out to people, do the things that just sort of shut off the computer, shut off the news. You have to do those things. Watch a show that has nothing to do with anything. Just take a break, read a novel. Not an intense one.
Exactly.
Right? Just take breaks, but definitely reach out. Know yourself. Know when you should reach out. Know when you've really changed because you have to acknowledge that your feelings are real. Everyone on the planet has been affected by this in some way. You talk to people and you hear their stories. Many of them have brought me to tears. Just listening to them, and they didn't even happen to me. So I think if we need to be kind, reach out to a counselor for sure. Do the telehealth, do the things that make you happy, but recognize if all of a sudden you're really not yourself. You can't get out of bed. You don't want to bathe. You don't want to eat. If you're able to work, you're just sort of disengaged. You need to reach out to a counselor.
The LA's medical services offer referrals for that kind of thing?
No, we don't at the county level. The medical services does have a psychology section, and we work very closely with all the city employees, but not necessarily the community.
But there's a lot of informational resources there for people to kind of see where we are right now and see what we should still be paying attention to.
Yes.
So before all of this happened, in theory, we hope that we are prepared for a lot of things in the Southland, but everyone across the planet was caught off guard in terms of preparation for what we needed. Masks, sanitizers, hospital beds, ventilators, all of those things. Has this been a lesson to government, medical communities, and people who are responsible for the good of all as to that we need to be more prepared?
Absolutely. And I think, we have computers now, and there's going to be some wonderful data and some wonderful debriefing of what we've learned and what we can do better. Definitely in terms of our supply of medical equipment, medical supplies, medications, all of those things.
Are we in good shape right now?
We are.
Because everybody pivoted. I remember one of the, poor Dr. Fauci, and yay Dr. Fauci, but one of the things that he was criticized by the Congress was, why didn't you tell us all to wear masks? And at the very beginning, it was like, well, A, we didn't know, and B, we needed those for the medical community. So now we're set there, right?
Right. Yeah, that was, we've come a long way from no toilet paper to plenty of PPE.
Yes, plenty of PPE.
Yeah.
So as far as moving forward and Los Angeles is concerned, how is it behind the scenes? Do we feel as if we are progressing in a good way? Is there anything that we should be aware of? Opening businesses, closing businesses has been tough financially, but now that seems to be somewhat stayed and settled. Does it look like we're going in the right direction?
I believe we are, and everybody plays by the rules. I think we'll be okay. I think the city has listened to the science, and we've listened to Dr. Frere, so we really absolutely listen to her, take her lead. But it really, 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 at the end of the day, boils down to individual responsibility.
Things have also loosened up in that regard. I mean, we used to walk into the grocery store and there was somebody there that was wiping down the cart before you even touched it. And now that person seems to have may not be there anymore.
Right.
So you need to sort of take that into your own hands. So maybe we need to take more personal responsibility and not necessarily have people force us into doing things.
Such a good point. I mean, I have wipes in my purse, and if I don't see something, I wipe it down myself. You know, it's just, and that's part of going out into the world too. Be prepared. Have the stuff you need. Have tissues. Have the wipes. Have hand sanitizer, so you're okay wherever you go.
Statistically, where will it feel as if it is no longer a threat? I mean, what is the ideal quantity of vaccinated individuals?
You know, that's still out for debate, but what I heard last was about 80%.
80%.
Yeah, so we have a long way to go. So we're about 12% right now.
And what about vaccine hesitancy? How is that impacting things?
What I would, yeah, and I don't know exactly, but there is a group of individuals, you know, or people that are just scared to get it, and that is understandable because it did happen so fast. But the science was absolutely there. In the olden days, they would test a new vaccine a linear, one step, follows the step, and now they compacted the steps so they all happened at the same time. So that's why they were able to get a vaccine out in a year. But for somebody who doesn't, might be scared, like, oh, what are they doing? What are they going to put? It's very safe. I would tell those individuals to learn as much as you can. The studies are online. I've read them. They're there. The CDC is just this plethora of information. Just, and if you're not sure what you're looking for, you can even just type in a word in their search engine, and it really help you. The information is there. Just talk to people, talk to your doctor, talk to people who have received the vaccination. We've given millions worldwide, and the adverse effects or where there were problems are just so minute, very little.
Well, I mean, even, there's been a couple questions about AstraZeneca, which is what is being utilized in the UK and, in Europe mostly, and yet in Africa, and they're still saying, no, it's great. But I guess what we have to really realize is that as though it may seem novel and new and rapid to us, the issue of virus inoculation has been a predominant concern with Zika and with SARS and everything. We've learned a lot in that realm to be able to come to this point to deal with this.
Absolutely. Yeah. And the AstraZeneca, they're actually doing the right thing in terms of if you see a little blip, you stop and then you study it. And that's what they're doing. So that's science. So I wouldn't count it out yet. I understand that vaccine will be the world's vaccine because it's very stable, it's very cheap, it'll be easy to get in places, remote places and countries that don't have a lot of money and funding or the ability to store a vaccine at 95 degrees below zero. So we hope it works. So that's we'll see what they say.
Well, I have no doubt, and it just feels as if there's just this hope and this lightness, and I hope that places that are still suffering will be able to feel this again soon too.
Yes.
Well, thank you, Joanne, for all of your wisdom over this period of time, and we'll talk about lots of great fun things in the future.
Well, thank you for having me.
Okay, and if people want more information?
They can go to corona/virus.la.
All right, thanks so much.
Thank you.
And that's a wrap on this LA Currents.